And we are in St James's Park. And this is the day of our anniversary. And some ducks just walked past.
That was delightful.
A couple of a girl duck and a boy duck. They were like, looked at our picnics. Didn't like any of it, so they just marched on by.
Yeah. However, we are very much enjoying our picnic.
Yeah.
All from Marks and Spencer's. Obviously, we're not dickheads.
Because it was close by and reliable.
Yeah.
We haven't been on a proper picnic for a while. We used to do it quite a lot.
Yeah, particularly in New York.
Yeah. We've got Monopoly Deal, so it's our wedding anniversary today. And so we're going to test the marriage.
Yeah.
Oh,
Tea.
there's a bad boy looking.
Excuse me. No, thank you, sir. So, it is 5 to 5 on Wednesday, the 1st of July. It's our wedding anniversary today.
That woman has been smoking pot for about 2 hours and is now finding a buzzball hilarious.
Yes, it's our 9th wedding anniversary. It's the day after the last thing that we filmed, which was me going in for a minor procedure at the hospital yesterday. And I was going to just do a quick update today on everything that has happened in the last 24 hours. Including that procedure. Went in for the procedure yesterday morning, everything went absolutely fine, except that I went in thinking that they were going to put a tattoo in me to help guide the surgeon when I have my resection done, hopefully quite soon. When I got there, I met with the consultant, who's the same guy I had last time. He was super nice, very apologetic that he didn't spot the fact that I had cancer, but insisted that he'd done everything that he could.
He didn't just not spot it, he was actively like,
This is fine.
there's nothing there.
This is fine, it's just a harmless polyp.
As consultants seem to be.
They do be like that.
They do be like that.
Anyway, so he then said, right, so you're here today to have your clips taken out. Basically, they had put staples in the last time they did the surgery on me. And he said, we need to take your clips out so that you can have an MRI. And I said, I've already had an MRI. It was last week. He looked very scared. And then said, right, I need to go and call your consultant then and figure this out. I don't know if he did that or not, but we went ahead with the procedure. He took the clips out. That was all fine. However, they have now confirmed that because the clips were in last time, they have blocked the view of the area on the MRI that I had last week. So that is unusable. So now I need another one. So we missed Father's Day for no reason. And now this coming Sunday, I will have to go back and have another MRI. That's not ideal. There was also, over the course of yesterday, just a general mix-up about what tests were happening when, because I still had an MRI scheduled for August around the same time as they booked an appointment for me to discuss the Crohn's disease thing. So we just sort of naturally assumed that those two things were related because they use MRIs to diagnose inflammatory bowel disease. As it turns out, again, no, that was wrong. They had just booked a cancer MRI for August for reasons that we don't know. So a guy tried to bring that forward to this weekend. We then got super confused, thinking, well, no, don't test me for IBD. You're supposed to be checking for cancer. Anyway, it all turned into a bit of a faff. I ended up emailing the gastroenterology department saying, I haven't heard from a cancer nurse specialist yet. Things are getting confusing. I'm having appointments in the wrong order. Could someone please get in touch? Someone got in touch within 5 minutes and we ended up having a phone call, and it's now everything has been ironed out, but it was quite a fretful kind of hour or so yesterday. So yeah, the upshot is I now have an MRI this Sunday. I have my next chat with my consultant on the 9th next week. And also the CNS, when I was on the phone with her, did confirm that although the MRI was unusable, the CT scan that I had a few days before the MRI came back completely clean. So as far as we can tell, there's no metastatic cancer, which, I mean, we didn't think there would be, but it's good to have that confirmed. So
all news is, we take all our good news where we can get it.
We absolutely do. So they will still do, as far as we know, the full resection. They'll take out all of the lymph nodes. They might biopsy the lymph nodes and then retrospectively say, yeah, there was a bit of cancer in there. I don't know. I don't think it changes the discussion about
Yeah.
whether or not I end up having to have chemo. I don't know if they can tell that just from a CT scan. But
I think the one thing I would say is that in terms of organising your appointments and everything like that, this has been an entirely different experience to when you had lymphoma. Because when you had lymphoma, we had Fran immediately. And so I think it sort of, for me, shows how important the role of a CNS is. Because basically, there was no CNS in your first meeting with Mr. Barn, and so there wasn't a CNS in that meeting. There isn't one person who has got a singular run through of all of your tests and all of your procedures, and you need that. So there's this constant sort of, basically a CNS needed to be in the MDT to say yes, he needs an MRI, but he needs his clips taken out first. There just needs to be that person.
Somebody should have spotted and advocated it.
Yeah, and so without that, it is important to sort of advocate for yourself, but it's important to run these down and make sure that the system is working properly, because if it doesn't, it does get really mixed up and it is incredibly confusing and stressful.
Yeah, and there's only so much we can advocate for when we don't know what's supposed to happen. I actually did realise when I was being fed into the MRI machine, it suddenly dawned on me that I did have metal clips left in me. As I was sort of waiting for it, I was lying there waiting for it to start, and all I could think to myself was, well, they booked it. They must know that this has happened and that they're in there. Because you fill out a form before you go in. It's like, what surgeries have you had? And I said, I've had the sigmoidoscopy, but it didn't occur to me to say, when they left metallic clips in there. So I basically, all I did was think, A, they probably know what they're doing, and B,
I'll find out real quick if this is
as soon as the magnet starts, we're going to find out if they can,
I think...
Yes, I was in the MRI machine. I figured they knew what they were doing. And then, I kind of went, okay, well, once the magnet fires up, we'll find out very quickly if this is a problem or not. And then it did. And I just sat there and went... And it was fine. So that was it. Anyway, turns out it's not that it was a safety thing. It's just it obstructs the view, blah, blah, blah. It
took, I think, initiative and prior knowledge on our part to be like, right, the right hand isn't talking to the left, we need to find a way to connect them. You had already been told you should have had a CNS, so you just emailed and said, I think I need to streamline the communications around this, can I please be contacted by CNS? And then that was literally it.
That was it, yeah.
And then, so whilst...
Course is corrected now, as far as we can tell.
It's absolutely fine. I cannot imagine having to navigate this in America.
Well, or even here, if you we only know about all of this because I've had cancer before.
Yeah.
And the Macmillan Centre and their CNSs are incredible, genuinely the best NHS staff we have ever encountered. They are really, really amazing. So, because we've had that experience, we know what it looks like, and this isn't it. It's the same hospital. It's just a different department of that hospital. But that's why you know that there should be a constant. Yeah. There should be one person advocating for you who has this oversight of the whole thing. If we hadn't had that experience, we would just be muddling through it, thinking, "Oh God, that's confusing."
That's confusing. There must be a better way to do it.
Which is how it is in America.
Yeah, and also you don't have, and you have to keep track of all your own appointments. You have to chase everyone down. The insurance company don't even talk to the doctor. So we're obviously very, 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 very lucky that it just took a couple of emails. But it's just sort of a hat on a hat when it comes to already being stressed out about something.
Oh, completely. But cancer is. We are lucky that we have generally had a really good, seamless experience of getting me treated for my various cancers. But it is overall a chaotic and confusing experience. And also, we were just saying, this CT has come back clean, but you do learn with it that you never accept good news until it is absolutely over. Absolutely confirmed. I think we're about to have some visitors again, so I'm going to put this back down. Oh yeah, right. Oh God, I keep coughing. Another day. Another bridge walk. Today I'm going back in to have another MRI done. Other news, I spoke to... Actually, I don't know who it was. I don't think it was the CNS, but it was a member of the team. And I've got all of my next week of appointments booked in. So, MRI today, nothing tomorrow. Tuesday afternoon, I have an hour-long pre-surgical assessment call with someone from the gastrosurgery team. Don't know what that involves. I just have to find somewhere quiet to go and sit down and do it. Then Thursday I'm seeing my consultant, and in theory I'm also having a bunch of kind of in-person tests done right after I've seen him. They're yet to be booked, but maybe they'll just do it on the fly. And then on Friday, I am seeing another person from the pre-surgical team who will talk me through all the prep that I have to do, like in advance of the surgery. So I think it's probably a little more involved than just bowel prep. And according to Claire and her Googlings, they're probably going to have to cite where the stoma will go in and maybe do some prep for that too. I don't know. I've no idea. That will be what it will be. But that's in person Friday morning at the hospital again. So quite a busy week with hospital stuff. And also I'm going through kind of the referencing process for my new job too. So, you know, won't be bored. It's really, really empty here. It's like 2 other people. But it is Sunday morning, so I don't mind having my appointments on Sunday morning if I'm honest. It's alright. I'm actually out already. But they took my phone, well, they took all my stuff off me when I first came in, so I wasn't able to film anything when I got here. But yeah, that's all right. Didn't last long, really, but I don't know how long I was in there, maybe 20 minutes? Actually felt like quite a long time. I think I've had a muscle relaxant as well, because I feel quite weird. I don't know what, they put something in me, but I don't know if it's like contrast fluid or what. I will ask them when they come out. But I'm just waiting to have my cannula removed now. Okay. And then I guess we wait and see results hopefully on Thursday. I don't know. That's contrived, isn't it? Ooh. Right. It is. Right, it's 7:45 on Thursday, the 9th of July. Today is one of the bigger days. So, in 1 hour's time, well, 1 hour's time we're leaving. In 2 hours' time, I've got my pre-surgical tests. So that's an ECG for my heart, blood tests and a swab. I don't know what the swab's about. I've just been told I have one. And then an hour after that, so 3 hours from now, I've got my meeting with the consultant to hopefully discuss the results of my scans and hopefully confirm a date for my surgery. Managing my own expectations, what I think will happen is we will agree that I need the surgery. I don't know that we will agree a date today. I've been told on the phone, I don't know if I've mentioned this, but I've been told that they've penciled me in for the 10th of August, but we will see, and we're still hoping that even if that's the case, they'll bring it forward a bit. So I don't know, maybe that'll come up in today's chat. So yeah, quite a heavy morning of tests and stuff. And then tomorrow morning I have a separate appointment to go and meet the specialist nurse who will teach me what prep I have to do for the surgery. Bam, new angle. That's about it. I was going to do an update yesterday. On Tuesday I had my call to do the pre-op assessment. They told me that would be an hour long. In the end, it was only 15 minutes. And it was a very quick over-the-phone checklist of what medications I'm currently taking, any trouble that I might have with sleep. Basically anything that they would have to know before giving me a general anaesthetic. Any trouble with my heart as well, actually, that was quite a big one. That might be why I'm having the ECG. Yeah, anything that they would need to know before they put me under for the surgery, and then questions around blood transfusions and that kind of stuff, because I have a history of lymphoma. A blood cancer. I can't just have a normal blood transfusion anymore. If I'm to have a blood transfusion, then it has to be irradiated blood. I haven't looked up the science behind that, but that is a thing. So yeah, that was actually very straightforward. So we went out and sat in a park because we don't have any phone signal in our flat. I was going to go back out to that park yesterday to film this bit of the update just for atmospheric purposes, but it was 38 degrees out there, so I just thought, probably not worth it. My legs aren't working. So, but that was all very straightforward, much quicker, much easier than I was expecting it to be. So that was Tuesday. Got my physical tests today. my catch up with the consultant, and then, like I said, chat about prayer tomorrow. Yeah, that's about it. We have popped into the St Pancras Hotel for a quick livener on the way home. Although mine will be non-alcoholic for obvious reasons, but I think we'll probably do a full update on the results of that meeting another time, possibly from Potter's Field.
Oh, yeah, that'd be
which
nice.
I meant to do yesterday. If we remember on the way home, we can do that. Okay. 1,000-yard stare again. Smile don't cost nothing, darling. I just filmed like a whole follow-up video sitting here in the hospital about the appointment that I've just had, and I wasn't recording. I was just talking out my phone, so I will follow up later. But that's the old hospital. That was a very informative, quite intense, roughly half-hour meeting. I'll go through the ins and outs later on because I'm not going to sit here and re-record it. But oh, it's a lot. What I will say while I'm here, because I'll forget otherwise, is about halfway through that chat, it was one of those moments where you just again suddenly realise the gravity of the situation, because like with all of the cancer stuff, you tend to just go appointment to appointment and thing to thing, like pinpoint to pinpoint, kind of in survival mode, compartmentalising everything all of the time. And every now and again, the reality of the situation just breaks through. So I can't remember which bit of the conversation it was, but at some point, I think she was talking about how, like, I'll be in the bed, I will find it difficult to move, so I need the nurses to help me sit up, and then all the various tubes that are going to be in and out of me, and my little morphine button and all of that. And again, just the reality just kind of comes in, and you're like, oh yeah, no, I am actually really ill. It's just like, yeah, then about 2 weeks after that, the histology comes back. We'll find out, you know, whether you're having chemo or not. And again, I've already had that discussion, but there was something about the sort of pragmatic, matter-of-fact nature of that that was just a little bit jarring. So yeah, I was just sat in that meeting like, oh, really poorly. But that'll pass. Again, it's just one day at a time, one foot in front of the other. We will get through all of this. It's going to be okay. But, all right, I'll tell you the rest of it later. Hi.
Hello.
Right, not cancer today.
Okay.
We are heading to Pimlico to have lunch with a friend of my uncle.
Yeah.
That's it. And then I'm promising that we will go to Potter's Field later.
And do an update.
Do an actual update of all of the appointments that happened this week and what is yet to come. It's now Sunday the 12th at about 7:05 p.m. Thursday was the big day. I did film bits and pieces of that day, but essentially the thrust of it was I had a few tests in the morning. I had a blood test, I had a mouth swab to just check for MRSA and other superbugs. And what was the other thing I had?
Height, weight, blood, ECG.
Oh, I had an ECG to check my heart. I don't know if that's standard or because I've got a difficult heart. No idea, but we'll just wait and see what they come back with from that. Then we saw my surgeon, confirmed that the surgery will indeed take place on the 10th of August. So he's going on leave for a couple of weeks, and then the day after he gets back, basically, he's doing my surgery. He's booked the robot for the privilege. So because he's away and they've had to make the booking for the Da Vinci robot, it's unlikely they'll bring that forward. I think we are set on the 10th now. So that's a month away, give or take. And in the meantime, my new job hopefully will start in kind of a temp kind of fashion. So they're basically planning to put me on bank staff so I can duck in and out as and when I need to over the next few weeks. And then on Friday I had the preparatory check with a different CNS. So I have now been assigned a CNS who came to our meeting with the surgeon. She's absolutely great. But this was, Friday was a different one. So this was a specialist who just preps people for what they have to do for surgery. Obviously my surgery is a month away, so I've got some time between now and then. But she gave me all of the protein shakes I need, the bowel prep stuff I'm going to have to take, and explained what to do beforehand, and then started to give me a bit of information about recovery and how I'll probably be in the hospital for about a week. I'll have a physiotherapist come round and help me out to teach me how to move again once they've done the surgery, and the sort of exercises that I'll have to do to prevent a DVT. I think that's all. That's not specific to bowel surgery. I think that's just pretty normal post-surgery stuff. I think that probably covers most of it. I'll think of other stuff.
It was a big week for appointment, because it was, if you go from Sunday, it was MRI Sunday, surgery pre-prep Tuesday, Wednesday day off, Thursday
physical tests, and then surgeon in the morning, and then Friday surgery, proper surgery pre-prep. Yeah. So it's just a lot of stuff. Been an emotionally heavy week.
Yeah, we were saying that every time we go and see them, they layer on a bit more information. So there's every time there's a little bit more, this is very aggressive and you won't be able to do X, Y, Z for a really long time.
I can't swim or go to the gym for 3 months post-surgery, but I can walk around. And the likelihood of me needing chemo hasn't increased, but they're talking about it a lot more pragmatically now, so everything is a bit more like, then we'll decide if you need chemo, and if you do, this is what will happen. And less, there's an outside statistical possibility you might need it. It's more just, they'll remove the whole section, they'll remove the nose, they'll biopsy them, all of which we knew. And then if you need chemo, this is how it will be. So that's all starting to feel a bit more real. However,
we can only deal with the one thing at a time.
One thing at a time. And we won't know whether I will need a chemo until a couple of weeks after the surgery, so no point stressing until then.
In the meantime, I've got 2 more weeks at work, and then I'm going to be off for 2 weeks before you have the surgery, so we can just have a bit of calmness in the house, because I'm not a calm worker. Well, my job is just busy, and therefore
it's a lot for you to have to divide your attention between
project busy,
looking after me and doing your full-time job.
So I think it would be nice, but I don't have to look after you at the moment, but it would be nice to have a couple of weeks together before the sort of hospital times start. So that should be good.
Even if I'm, by that point, actually working, as it turns out. One thing at a time. I'm still going through referencing, so fingers crossed. So, I think that's about it. So, Good morning. You just filmed yourself making coffee. Why did you do that? You never film yourself making coffee. Well. So it's 7:30 in the morning. And the reason that I'm up and making coffee at this time is because that new job that I got emailed me last night, yesterday afternoon at about 4, and said, hey, do you want to come in tomorrow? So I said, sure. What have you got in mind? Thinking they just wanted me to bring my passport in or something, and I'm just starting today. So that's quite sudden, but very exciting. I haven't been to work since March, and I've been navigating, as you've seen, this whole cancer thing while not working, so really, really exciting to go and have something to do. So basically what they've done is, because I still obviously have this huge surgery coming up and I'll need a month off, I talked through the conversation that I had with them about that, and what they've come back and offered is what they call a bank staff contract, which is usually for nurses, but in my case, it doesn't make any difference. It just means I sign a casual contract with them. I bill by the hour. I still do the same 9 to 5 that I would normally do. They just pay me as if I was a nurse on an hourly retainer for the same amount. But what that does mean is that I can be a lot more flexible with my time. I can work around my appointments, and then I obviously won't be paid for the time that I'm recovering from surgery, but I shouldn't be. I never planned to be. But it gets around that whole what do we do with the leave situation. So I'll be on this contract for the next few months until I'm done. And then once I'm fully recovered, they will bring me on properly full time. And again, it's still actually just a mat cover. I'm only supposed to be there for a year, but it really does help. Like, it truly helps. I guess because they're an organisation that really understands cancer, so they know about the chaos of it and the unpredictability and the fact that things move around all the time. And I will need to prioritise my appointments and the kind of life around them, because a lot of them aren't just straightforward show up at the hospital. As you've seen, a lot of them require sometimes days of preparation. So being able to flex my time around that and actually work, like, I'm going to make money today. I'm not going to spend money. Well, I am. I'm going to spend money getting there and on lunch, but I'm actually going to make money. So yeah, that's pretty amazing. I think, obviously, let's see how it goes, but it feels like potentially I've accidentally landed on my feet with an organisation that understands the situation I'm in as well as they do. So that's very optimistic, but we need all the optimism we can get right now. So I'm going to drink my coffee, hop in the shower. I've just steamed my clothes. It's a decent temperature this morning, but I'm still going to put my shirt in a Ziploc bag and take it with me and then get changed when I get there. Because it's summer and that's just what I do anyway. Right, rambling. I'm going to go get on with it. Right, before I forget, I've just done my first day at work. It was amazing. Well, you know, it wasn't an amazing day. I just did safeguarding training and a couple of inductions, but I'm back at work. Probably the most excited person in the world to be at work, but after the last few months, it's a miracle. Well, I'm just heading home now. I just thought I'd record that as part of this process, but broader update. I found out today a couple of things happened. So I had a call from my lymphoma cancer nurse specialist, my CNS, just to check in. She'd heard from from a meeting, I don't know who with, but with some of the other nurses and oncologists. Someone said, oh, we've got a Hodgkin's patient who's just presented with bowel cancer and he's only 38. And Fran went, oh God, I bet that's Ed. And said, who is that? And they said, oh, it's Mr. King. So yeah, she found out and gave me a call just to check I was okay, because she's the best person in the world. I also had a call from a different CNS who specialises in underlying genetic conditions, and particularly one called Lynch syndrome, which is heavily linked to bowel cancer and a few others. So she's going to come and find me in hospital when I'm in, and run some tests on me to see if I have an underlying genetic condition. It's very unlikely that if I have one, that it would explain both of the cancers. She said it's very unlikely. I don't know the ins and outs, but so that happened. And then during that, I also found out my surgery is actually being pushed back to the 17th. So that's an extra week, which I think my gut reaction to that, excuse the pun, was, oh God, no, don't push it back. Life admin. But that was forgetting that I was currently sitting at work in my new job, which I am doing. So it doesn't matter if we push it back now because I've already started. And if you'll remember in my June update, and by if you remember, I'm pretty much probably only talking to myself. So you will, Edward, you've made that yourself. But anyway, in the June update, I talked about how my apprehension around surgery dates was because everything else around starting work and everything was linked to that. I could only start after surgery in theory. But I've started now, so off it goes. He's not going to have that Porsche for a long time if he keeps doing that. God. All right, that's it. That's the update. This has consumed most of my walk back to the tube station. Don't know when I'll next check in now, but we'll see. Oh yeah, really quick check-in at lunchtime. It's Friday the 17th at about 1:15. And I've had a good first week in my new job, but everyone's having like a group lunch for someone's leaving do today. And they are ordering in from a nearby Japanese place, which ordinarily I would love, but my tummy kind of, everything still hurts. It's all a bit sore. So I've gone to Sainsbury's for a chicken sandwich, which is going to make me look really antisocial, but I'm trusting that they will be understanding. Bam! First week of my new job done. Not really gonna give any feedback here right now, but it's been great. Settled in. Think it'll pick up properly next week, but I would have been disappointed with myself had I not marked it for my little diary. So that's it, off home for my first weekend after work for several months, which is really nice. Okay, bye.